The short answer is yes. 22.8% of women who were enrolled in Medicaid programs in 46 states, they all filled an opiate prescription during pregnancy. And then several states have also identified that substance use is a significant risk factor for pregnancy associated deaths. So, Suboxone or buprenorphine treatment during pregnancy is safe and actually endorsed by the American College of Obstetricians and Gynecologists, also known as ACOG, and the American Society for Addiction Medicine, which is known as ASAM. Now, these groups concluded that pregnancy in women with opioid use disorder should be co-managed by obstetric care providers and healthcare providers with addiction medicine expertise. Now, this is something they also concluded. Opioid agonist pharmacotherapy, which is using buprenorphine, methadone, or Suboxone, is recommended therapy and preferable to medically supervised withdrawal because withdrawal is actually associated with higher relapse rates and can lead to worse outcomes. Not to mention, withdrawal symptoms can severely harm the baby. So, now, this is all great to hear, and there is research to support the use of Suboxone during treatment for pregnancy. But what are some of the risks and concerns, Danny?
Initially, pregnant women were prescribed Subutex instead of Suboxone because it was unknown whether the naloxone component of the Suboxone might be dangerous to a developing fetus. But research from ACOG in 2017 confirmed that outcomes were similar between women on Suboxone or buprenorphine plus naloxone when compared to women on Subutex or buprenorphine alone. There was no increased risk of adverse events. Well, one study from the Journal of Addiction stated findings suggest no obvious significant adverse maternal or neonatal, aka the baby, outcomes related to the use of buprenorphine and naloxone for the treatment of opioid dependence during pregnancy. A separate study mentioned that there were no significant differences in maternal outcomes for buprenorphine and naloxone compared to buprenorphine or methadone-assisted withdrawal. This is important because buprenorphine use can lead to shorter stays and less morphine required to treat neonatal opioid withdrawal syndrome, or NOWS.
Thank you for bringing up NOWS. So, NOWS, or neonatal opiate withdrawal syndrome, is a withdrawal that may result from chronic maternal opioid use during pregnancy. Now, it's an expected and treatable condition seen in about 30 to 80% of infants born to women taking opiate agonist therapies. Now, these symptoms normally occur 72 hours after birth, and they can cause trouble feeding, seizures, irritability, high-pitched crying from the baby, and even dehydration. Buprenorphine therapy is preferred because 52% of infants had NOWS, or neonatal opiate withdrawal syndrome, compared to 69% using methadone for treatment of OUD. No matter what, these symptoms are managed by fantastic NICU teams in the hospitals, but it's really good to know this information and the risks that are associated with the use of opioids during pregnancy. It's also recommended that the mother continue breastfeeding after pregnancy, and this is huge. The American Academy of Pediatrics recommends breastfeeding for women taking methadone and buprenorphine regardless of maternal dose because the transfer of these medications into breast milk is actually pretty minimal. By doing so, crucial skin-to-skin care and bonding continue to, and which this helps further decrease the now symptoms.